Greetings, I'm Dr. Max Gomez at the 5th International Vatican Conference, and I'm joined now by Rick Anderson from DarioHealth. Welcome, Rick.
Thanks for having me.
You bet. So let's talk for a minute here about technology, because when we talk about technology and healthcare, I think most people immediately go to biology. You know, how do we make better cells, better drugs, and so forth, right? But you're taking a different tack here using digital health and digital technology to improve healthcare. How does that work?
So it's really taking connected devices. So think about like glucose monitors, blood pressure monitors, all kinds of other devices. In the future, we'll probably have other kinds of sensors, temperature, vital signs, et cetera, things like that. Combining it with software that enables people to achieve things that they couldn't necessarily achieve on their own. And really a key component of that is having artificial intelligence and data that sits behind that that can really help personalize journeys for people. And then combining all of that still with humans. Humans make a big difference. And the reality is that everybody's a little bit different in how they want to interact with the healthcare system, how they can get better, what their journey was to get here, what their journey is going forward. And so it's really combining those components in a way that engages people, because what's most important in terms of delivering healthcare is, what is it that people want? How do they get value out of that? And as long as they can get that value, they will continue to stay engaged. And if they stay engaged, then the outcomes will get better.
And so the technology, we've all experienced failures of technology, obviously. And it sounds like the technology is now moving to the point where it is reliable enough that we can put our health in the hands of this technology?
Yeah, I think that there's really different levels of that. And, there's a regulatory scheme that helps out with that as well in terms of, where I think digital can be really helpful is how do we make providers, coaches, and others in the care delivery system superhuman, if you will? How do we know where to interject them? So, a member that needs a human, where do we put that? Somebody who doesn't need a human right now, sometimes one of the hardest things to understand is when not to intervene. But then it's also taking that data and really feeding it to a healthcare provider so that then when they interact with a member, they're dealing with a lot more data. I mean, the reality is most, especially chronic disease, but a lot of illness really is what happens between provider visits. So how do we give those physicians and providers more data so that can inform their care decisions? And then in between those visits, how do we use that to support the care journey that the physician promoted? We're not necessarily, we're getting into the world where, a computer or an AI-based system would be able to, make decisions and suggest care. I think for the most part, though, we're really still at the point where it's supporting that care.
Exactly. Good. So let's talk about chronic disease, because I think modern medicine has gotten to the point where we can deal relatively well. There are differences of opinion on this, of course, with acute disease. And to the point, though, that chronic disease is now really overwhelming and overtaking the healthcare system and creating a health and even economic crisis. How does digital health play into that? How is that going to help with chronic diseases?
Well, I think, really, if you think about digital health, it has a unique opportunity. It can deliver more quality care to more people at a lower cost. And, well-designed solutions can efficiently deliver that care over a broad basis where there's not as many providers as you would want to have, or maybe you can bring more quality care into that. And, as we continue to manage increasingly complex patients at home, we need to be able to have the data to help people do what they need to do from a remote perspective. So, how do you enable physicians, and then how do you really help those people that are in their homes? How do you help them get better? How do you help them stay better? And part of that's a biofeedback loop, so having the devices that can give them the data to do it. Some of it's education, and some of it's really trying to just engage those people on a day-to-day basis because it's the behaviors that they need to change over a period of time that will help manage those chronic conditions. And digital health, because of its reach, really has the ability to do that on a cost-effective basis as well.
And I think it's particularly important in chronic diseases, this day-to-day or even hour-to-hour kind of monitoring makes a world of difference. And that's where these kinds of digital health monitoring can make a world of difference as well, right?
Yeah, no, absolutely correct. As I just said, being able to give that data to the right people, to supercharge your care team, and really to give that to people, because understanding those behaviors, changing behaviors, is very, very challenging. And maybe it's the 100, 200, 300 things that you need to change in order to better your outcomes, improve your chronic conditions, help you manage that. But the reality is, behavior change is hard. Managing chronic conditions is hard, and oftentimes people stumble. And when they stumble in today's system outside of digital health, what we're really telling people is, try harder. But unfortunately, many people, maybe most people, really just give up. So, how do we give people the tools, not just to help them manage their health, but make it easy? And if we can, make the right thing to do the easiest thing to do.
And the feedback will help in all of this. That kind of ongoing feedback, I think, would be very important in behavior modification, as it were. But let's talk about access, because that's another big issue. We can talk about artificial intelligence and all these other things, but if the right people don't have access to these systems, then we're just talking to ourselves. How do we ensure, or what's it going to take to make sure that we can get the right people access to these kinds of systems?
Well, I mean, you're talking about one of the real challenges that we have in healthcare, really worldwide. And I think this is one of the most promising and exciting parts about digital health. It helps us deliver high quality, tailored solutions to patients, on a broad scale and at a low cost. And you have, when you talk about digital health, sometimes we include telehealth in that, but the reality is digital health can be delivered with a live provider or asynchronously, and can be delivered on a one-to-many basis. And the way that really helps in terms of delivering care is it can be delivered without continuous high-speed internet connections. You can do it on a low-speed connection. You can do it when you get Wi-Fi, off of one of the various places. You can go into Starbucks, you can get your Wi-Fi, and you can, get your healthcare essentially in Starbucks. What a world we live in. It can be delivered when it's convenient to the patient. So think about, people that are working, one job all day, or maybe 2 or 3 jobs in many cases. They can get care early in the morning, late in the evening, on weekends, whenever it's convenient to them, not necessarily when their provider is open. And it can be delivered into remote areas. And, there's many areas, even here in the US, where we don't have enough providers, or in many cases don't have any providers. And, the ability to deliver into that and lower barriers like transportation. If I don't have to find a ride to my doctor's office and I can get that care in my home, I'm more likely to get that care. And I think one of the biggest things that it can help with is how do we get higher quality care delivered more continuously? And digital health is really effective at doing that as well.
I think digital health is part of the healthcare revolution that we're going to be seeing, hopefully in the very near future. Rick Anderson, thank you very much for your time and your perspectives and your viewpoints. And let's hope that all of this, or some of it, or much of it, comes true. Thank you again for your time.
Thanks for having me, Max.
You bet.